Let's talk about skincare, specifically those little lifesavers called pimple patches. They've exploded in popularity, and for good reason. Gone are the days of harsh spot treatments that dry out your skin. Pimple patches offer a gentler, more targeted approach to banishing blemishes. But are they too good to be true? We've all been there. A huge zit decides to appear right before a big event. That's where pimple patches come in. These small, translucent stickers work wonders on surface-level pimples, absorbing excess fluid and reducing inflammation. The result? Your pimple is less noticeable, less red, and heals faster. Essentially, pimple patches create a protective barrier over the blemish. This prevents you from picking or touching the area, which can introduce bacteria and worsen the situation. Plus, they look kind of cool, like a tiny futuristic bandage for your skin. Intrigued? Let's dive deeper into the world of pimple patches and see if they live up to the hype. First things first, let's address the safety concerns. The good news is that pimple patches are generally considered safe for most skin types. They're designed to be gentle and non-irritating, even for those with sensitive skin. Of course, it's always a good idea to do a patch test before applying anything new to your face. Place a patch on a small area of skin, like behind your ear, and wait 24 hours to see if any redness or irritation occurs. Another great thing about pimple patches is that they're usually free of harsh chemicals and fragrances. This makes them a great option for people who are prone to breakouts or have sensitive skin. However, it's important to note that pimple patches are not a miracle cure. They work best on surface-level pimples that are already open or have a whitehead. They may not be as effective on deep cystic acne. So, what's the secret sauce behind these tiny blemish busters? Pimple patches are typically made with hydrocolloid material. It's a type of gel-like dressing that's been used in the medical field for years to heal wounds. Hydrocolloid dressings work by absorbing excess fluid, pus, and oil from the pimple. This helps to reduce inflammation, redness, and pain. It also creates a moist environment that promotes healing and prevents scarring. Some pimple patches also contain additional ingredients to boost their effectiveness. These may include tea tree oil, a natural antibacterial agent that helps to kill acne-causing bacteria; salicylic acid, a beta-hydroxy acid that exfoliates the skin and helps to unclog pores; hyaluronic acid, a humectant that attracts and retains moisture, keeping the skin hydrated; and niacinamide, a form of vitamin B3 that helps to reduce inflammation, redness, and hyperpigmentation. Side effects. The not-so-glamorous side of pimple patches. While pimple patches are generally safe for most people, some potential side effects can occur. These side effects are usually mild and temporary. The most common side effect is dryness or peeling around the area where the patch was applied. This is because the hydrocolloid material can absorb moisture from the skin. To avoid this, make sure to moisturize the area around the pimple before applying the patch. In rare cases, pimple patches can cause irritation, redness, or itching. If you experience any of these side effects, discontinue use and consult with a dermatologist. It's also important to note that pimple patches are not meant to be used on open wounds or broken skin. Doing so could increase the risk of infection. Timing is key. When to use a pimple patch. Knowing when to use a pimple patch can maximize its effectiveness. The best time to apply a pimple patch is after you have cleansed and toned your skin. If you typically use other skincare products at night, like serums or moisturizers, it's best to apply them after the pimple patch. This helps to prevent the patch from sliding around or losing its adhesion. Avoid using pimple patches on pimples that are deep under the skin or haven't come to a head yet. These types of pimples usually require a different approach, like a spot treatment containing benzoyl peroxide. Pimple patch, power, how often should you use them? Pimple patches are designed to be used as a spot treatment, so you don't need to use them all over your face. Simply apply a patch to the affected area and leave it on for the recommended amount of time, which is usually 6 to 8 hours or overnight. You should start to see results within a few hours of applying the patch. The pimple will appear flatter, less red, and less inflamed. Depending on the size and severity of the pimple, you may need to use a patch for several days in a row to completely heal it. Once the pimple has flattened and the fluid has been absorbed, you can remove the patch. Remember to be gentle when peeling it off to avoid irritating the skin. Join the skincare squad. There you have it. Pimple patches are a game changer for anyone who struggles with breakouts. They're safe, effective, and easy to use, making them a must-have in any skincare routine. For more tips and advice on all things skincare, join the Skincare Now community. We share the latest skincare trends, product reviews, and expert advice to help you achieve your best skin yet. Don't forget to subscribe to my channel for more skincare tips and tricks.